Good afternoon. We're here with Humboldt County Public Health Director Michele Stevens for the July 20th media availability. Thank you for being here with us.
You're welcome.
We just have a couple questions for you today. Can you provide any update on county efforts to protect and care for homeless people amid the pandemic, including how many homeless residents have been deemed high risk and given long-term shelter?
Sure. Early on, we secured porta potties and hand washing stations, and those are placed throughout in various places throughout the county. We also have secured through the EOC face coverings for homeless individuals, and there's a process in place with providers for collecting used ones, washing them, and then reissuing them to people experiencing homelessness. And then in addition to that, there's been a screening process implemented at various service provider organizations to screen individuals for COVID-19 symptoms. And then we have a process to get them tested and then temporarily housed in a motel while they're awaiting results, as well as those that are considered high risk. As the screening process also tries to capture those that are considered high risk and then temporarily house them in motels as well. To date, we have about 115 unique individuals that have been temporarily housed or are temporarily housed in approximately 60 rooms. Some have exited the program on their own, by their own choice, and some have exited due to acquiring permanent supportive housing. And then also we have an additional 15 rooms that we're adding in the next week.
Excellent. Food insecurity has obviously increased substantially since the beginning of shelter in place, and Food for People has reported unprecedented need. How has this impacted county programs and enrollment in CalFresh in recent months?
Sure. So, just to give context, in March and April of last year, so in 2019, we averaged about 1,200 CalFresh applications a month. And so for March and April of 2020, there were about roughly 1,400 in March and about 1,850 in April. And so that was a 56% growth in April. That was the largest growth that we've seen thus far for CalFresh applications, as well as the caseload size. And then for May and June, we saw a decrease actually. Quite a bit. For May, there was about a 28% decrease. There were 959 applications in May and then 865 applications in June. It just shows that early on in the pandemic, people were definitely hit hardest in those months. We suspect that with people acquiring unemployment, that has helped offset the need for CalFresh, and so that's why we might have seen an application reduction in the number of applications so far.
Excellent. That was it. Thank you so much.
You're welcome.